It may shock you to learn that consuming the wrong types of nuts regularly can elevate your risk of heart disease by up to 48%, especially if you're in your golden years. This statistic isn't arbitrary. It stems from extensive research published in the American College of Cardiology journal, conducted across multiple years. Now for the alarming part. Some of the most common nuts stored in pantries can silently increase blood pressure, trigger inflammation, clog arteries, and even accelerate cognitive deterioration. Yet many elderly individuals consume them believing they're making healthy choices. One particular nut, which we'll identify later, contains high levels of a toxic substance that, when consumed regularly, can damage your liver, kidneys, and mental faculties. You likely have this nut in your snack collection already. The same, one that many low-carb diet enthusiasts claim is beneficial, but it could be inflicting permanent harm on aging bodies. Don't worry though, we've got your back in this video. Here you'll discover the most thorough guide to nut consumption, covering which ones are safest, best for cardiac health, most beneficial for cognitive function, and which ones you should eliminate entirely. Also, make sure to watch until the conclusion, because there's a troubling reality about the number one dangerous nut that few discuss, and it could be significantly harming your health without you realizing it. Please like this video and subscribe to our channel for similar content before we begin. Also, share in the comments where you're viewing from. Now, let's explore the 4 varieties of nuts that seniors should incorporate into their diet. Fourth, the bone-fortifying champion, almonds. Almonds rank among the finest foods for an aging physique, thanks to their high calcium and vitamin E content, which together maintain bone strength. As we age, fractures are more likely to cause serious complications since our bones naturally become more porous and fragile. Bone density loss accelerates after 65, but consuming just 1 mug 4 cup of almonds daily helps slow this process by providing approximately 97 mg of calcium. Beyond their calcium content, almonds are rich in magnesium, a mineral often deficient in elderly individuals. This is what makes almonds exceptional. Magnesium acts as a transporter, preventing calcium from damaging arteries, and instead directing it to your bones. The beneficial monounsaturated fats in almonds also support heart health by reducing harmful LDL cholesterol levels, which is crucial as cardiovascular disease risk increases with age. I recommend seniors consume 15-20 almonds daily, preferably raw or dry roasted without salt. Almonds effectively combat constipation due to their high fiber content, approximately 3.5 grams per serving, which affects roughly 40% of the elderly population. Most importantly, studies by Tufts University researchers have shown that almonds can help prevent oxidative damage to brain cells that many fear occurs with aging. Look for skin on almonds, as their skin contains flavonoids that, combined with vitamin E, double their antioxidant potency. Caution: almonds pose a choking hazard for elderly individuals with swallowing difficulties, so thorough chewing is essential. Thirdly, walnuts, the cognitive function enhancer. Walnuts stand out as one of the premier brain foods for seniors, appropriately resembling the brain, the very organ they nourish. These remarkable nuts contain more plant-based omega-3 fatty acid, alpha-linolenic acid, than any other common nut. This is particularly significant for aging brains, as omega-3s support neurotransmission and maintain brain cell membrane integrity. Seniors who consumed just 1.5 ounces of walnuts daily for 8 weeks demonstrated notable improvements in cognitive processing speed and mental flexibility. According to recent research published in the Journal of Nutrition, walnuts' unique polyphenolic compounds may inhibit the development of neurodegenerative conditions like Alzheimer's and dementia by crossing the blood-brain barrier and directly fighting inflammation in neural tissues. A lesser-known fact is that walnuts contain melatonin, levels of which naturally decline with age, often causing sleep disturbances for many seniors. Some find that consuming a handful of walnuts before bedtime improves their sleep quality. The combination of arginine, an amino acid promoting blood vessel function, and polyphenols, which reduce oxidative stress, makes walnuts extremely beneficial for cardiovascular health. In fact, walnuts can enhance blood pressure medication effectiveness by helping seniors maintain arterial flexibility. For optimal benefits, store walnuts in the refrigerator to prevent their delicate oils from becoming rancid. Try to consume 7 to 9 walnut halves daily. As an additional benefit, cracking them yourself when possible helps maintain fine motor skills. Don't be deterred by walnuts' naturally protective flavor. Their slight bitterness indicates potent antioxidant content. Secondly, pistachios are excellent for blood pressure management. Regarding nuts' health benefits for seniors, pistachios may be the most underappreciated, particularly for blood pressure regulation. Pistachios are distinctive for their low sodium and high potassium content, approximately 285 milligrams per serving, making them an ideal snack option. This mineral balance is especially valuable for elderly individuals, as it helps prevent age-related kidney sodium retention. It can reduce systolic blood pressure by 3 to 5 points, similar to some prescription medications, but without adverse side effects. Additionally, pistachios' lutein and zeaxanthin deserve mention, as these carotenoids protect against age-related macular degeneration, the primary cause of vision loss in people over 60, by concentrating in the eye's macula. Seniors can enjoy pistachios' pleasant crunch without concern about potential damage to vulnerable teeth and gums that harder nuts might cause. Beyond their visual appeal, the antioxidants in their distinctive green and purple hues help neutralize free radicals that accelerate bodily aging. Pistachios are particularly suitable for seniors due to their practicality, preventing overconsumption and offering a mindful eating experience that can be both calming and cognitively stimulating. The shelling process naturally slows consumption. The International Journal of Obesity reported that the visible empty shells help seniors better monitor their intake by providing a visual consumption indicator. If you have arthritic hands, you can still enjoy shelling pistachios by selecting partially opened ones. Aim for approximately 49 pistachios daily, or roughly 1 ounce of unsalted or lightly salted pistachios. For the 25% of Americans over 65 who are diabetic or pre-diabetic, pistachios' 3 g of fiber per ounce greatly helps regulate blood sugar levels. First place, Brazil nuts, a thyroid issue remedy. We've ranked Brazil nuts first because they support thyroid function, a crucial yet often overlooked aspect of healthy aging. These exceptional nuts are the richest known selenium food source, with 96 micrograms, 137% of your daily requirement, in just one nut. This is extremely important because thyroid disorders affect up to 20% of people over 65, with many cases going untreated as symptoms are often mistaken for natural aging. Selenium, abundant in Brazil nuts, is essential for thyroid hormone activation, which supports energy production, metabolism, and mood regulation. Beyond thyroid support, the specific fatty acids in Brazil nuts help preserve myelin, the protective sheath around nerve cells that typically deteriorates with age. This myelin maintenance may help seniors maintain reflexes, reaction times, and cognitive processing speeds. Interestingly, selenium in Brazil nuts is organically bonded, making it more bioavailable and easier for your body to utilize than synthetic selenium supplements. Brazil nuts are so potent that just a few provide benefits, and their rich, creamy texture makes even small amounts satisfying. In fact, I advise seniors to limit consumption to 1 or 2 Brazil nuts daily due to potential negative effects from excessive selenium. When purchasing Brazil nuts, try to select those still in their shells. This natural packaging preserves nutrients longer. Store them in the refrigerator to prevent spoilage due to their high fat content. Brazil nuts' combination of fiber and natural oils aids intestinal regularity, providing additional benefit for seniors experiencing constipation. Many elderly individuals find comfort in less nutritious snacks, but Brazil nuts offer a superior alternative with their naturally sweet, buttery flavor. Most astonishingly, recent evidence suggests that certain antioxidants in Brazil nuts may slow the natural shortening of telomeres, the chromosome caps that typically shrink with age and influence cellular aging. If you're 65 or older, these nuts are ideal for you. In this next section, we'll discuss nuts that some seniors might want to avoid or consume cautiously. Inflammatory trigger number 4, peanuts. Despite their widespread consumption, peanuts present several concerns for many elderly individuals. First, it's important to understand that peanuts aren't actually nuts. They're legumes that grow underground. This makes them susceptible to mold and aflatoxins, mycotoxins naturally produced by certain molds that can damage the liver and increase cancer risk with frequent consumption. This risk increases as we age because our body's detoxification mechanisms inevitably become less efficient. More concerning for elderly individuals is that peanuts contain proteins that can trigger inflammatory responses in many people, even without a true allergy. Aging individuals already face increased risk of joint discomfort, cardiovascular stress, and cognitive decline. This low-grade inflammation can exacerbate all three conditions. Most Americans already consume excessive omega-6 fatty acids compared to anti-inflammatory omega-3s. Peanuts' high omega-6 content compounds this issue. Many physicians neglect to warn elderly patients about the potentially dangerous interaction between peanuts and blood thinners like warfarin due to peanuts' vitamin K content. Commercial peanut butters worsen these issues for aging cardiovascular systems with added hydrogenated oils, sodium, and sugars. The 63% of American seniors with hypertension already have enough concerns. Even natural peanut butter without added salt can elevate blood pressure. Another problem is that improperly stored peanuts become rancid and generate harmful free radicals. The common commercial practice of dry roasting peanuts also produces acrylamide, a compound with potential cognitive deteriorating effects. This is particularly concerning for those already worried about memory loss. Even if you've consumed peanuts regularly without noticeable effects, substituting one of our recommended nuts, even just 3 days weekly, can provide needed nutrients while reducing exposure to these harmful substances. Third, cashews. The hidden sugar spike. Cashews present a unique risk to seniors due to their exceptionally high carbohydrate content and glycemic impact. Unlike true tree nuts, cashews contain fewer protective compounds and significantly more carbohydrates, approximately 9 g per ounce. With about 25% of people over 65 having diabetes and another 48% having prediabetes, this can trigger a harmful blood sugar response. This is particularly concerning because cashews have a healthy reputation. So many elderly people consume them liberally without considering potential blood sugar effects. Cashews' smooth, curved shape creates a choking hazard that shouldn't be overlooked, especially for those with swallowing difficulties. They're among the most commonly aspirated nuts among seniors. Nutritionally, cashews are suboptimal because they contain high levels of oxalates, compounds that bind to calcium in the gut and reduce calcium absorption, a major concern for elderly individuals already at risk for osteoporosis. For those already at increased risk of kidney stones, which rises dramatically after age 60, these same oxalates present additional danger. Another hidden issue involves cashew processing. During the extensive processing required to remove urushiol, a toxic substance also found in poison ivy, cashews lose significant nutritional value. Many commercial varieties are oil roasted and heavily salted, adding unhealthy fats and sodium that can worsen blood pressure and cardiac strain. Cashews contain enzyme inhibitors that can impede protein digestion, particularly problematic for seniors who often already struggle with digestion and protein absorption. Few realize that cashews' creamy texture makes them easy to overconsume, potentially contributing to weight gain during a life stage when maintaining healthy weight becomes increasingly challenging. Regularly substituting walnuts or almonds for cashews provides a healthier snack with fewer risks to aging bodies while offering superior nutritional properties. 2. Macadamia nuts pose significant health concerns for elderly individuals despite their exquisite flavor due to their extremely high calorie density. They're the most calorically concentrated nut available, containing approximately 200 calories per ounce. With metabolic rates naturally declining with age, This adds further challenge to the already difficult task of weight management for seniors. Their extraordinarily high fat content, about 22 g per ounce, exacerbates the gallbladder's diminished efficiency. Macadamias can trigger painful episodes that might otherwise remain asymptomatic in the 15% of seniors with undiagnosed gallstones. Beyond their caloric content, macadamias contain among the highest saturated fat levels of any nut, approximately 3 g per ounce, which can elevate LDL cholesterol, a common concern for many elderly individuals. Their density and hardness present serious risks to the oral health of seniors with crowns, bridges, or weak teeth. This is especially problematic after age 65, when enamel weakens due to wear and decreased calcium absorption. Practically speaking, macadamias are among the most expensive nuts, potentially causing budget-conscious seniors to select cheaper varieties, more likely to be rancid or improperly stored, exposing them to dangerous oxidized lipids. Commercial macadamia's already poor nutritional profile is further compromised by oil roasting and excessive salting, adding sodium and damaged fats. Their rich, buttery flavor may lead to overconsumption, particularly for older individuals who may have less refined taste perception and prefer stronger flavors. Concerning is that many elderly people consume macadamias believing they benefit heart health, but research demonstrating nuts' cardiac benefits has largely excluded or minimized high-fat nuts like macadamias. Pistachios offer a substantially superior nutritional profile specifically suited to aging bodies, so consider switching if you've been regularly enjoying macadamias. The first, pine nuts. Pine nuts, known medication disruptors, rank among the most problematic nuts for elderly individuals for several reasons, particularly acute for this demographic. Most concerning is that they contain compounds that interact with over 60% of medications prescribed to seniors, potentially reducing medication effectiveness or introducing harmful side effects. While many prescription medications are known to interact with each other, this is especially true for statins, certain antidepressants, and blood pressure medications commonly prescribed to individuals over 65. Most physicians and pharmacists never inform patients about food-drug interaction. Risks, a major red flag. Most worrisome is pine nut syndrome, which causes pine nuts to impart a bitter metallic taste that can persist for weeks after consumption. While this may seem minor, it can severely impact older adults due to the correlation between taste alterations and decreased appetite and nutritional status. Research indicates that up to 42% of affected individuals experience significant weight reduction. The syndrome appears more prevalent among elderly individuals, possibly due to age-related changes in taste receptors and detoxification pathways. Pine nuts contain high levels of polyunsaturated fats that rapidly oxidize and generate inflammatory compounds, problematic for elderly individuals already managing inflammatory conditions like arthritis. Their small size and slick texture create aspiration risks. This is particularly concerning for older persons with swallowing difficulties or those taking medications causing dry mouth, an issue for over 70% of seniors taking multiple prescriptions. While protein absorption naturally decreases with age, pine nuts' enzyme inhibitors can further impede protein digestion during this critical period. Pine nuts are calorie-dense items that can contribute to weight management issues common after 65 due to their high oil content, even in pesto, their most common culinary application. Alarmingly, recent research indicates that compounds in certain pine nut varieties may accelerate age-related macular degeneration, the primary cause of vision loss among elderly individuals. After age 65, you should avoid these 4 nuts. A person's health, vitality, and cognitive function in their later years can be profoundly influenced by dietary choices regarding which nuts to consume and which to avoid. Remember, consistent application of small adjustments produces significant outcomes over time. Now it's your turn to share. Have you noticed health effects from adding or eliminating specific nuts from your diet? Tell us which nut had the greatest impact on your well-being. Share your thoughts and experiences in the comments section. We value your feedback.